Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Muscles of mastication. So under this muscles of mastication, first will be the origin. Under origin, the first muscle we are looking at is the lateral pterygoid. So origin of this is the upper head and the lower head. Upper head is from the infratemporal fossa, infratemporal surface and the sphenoid bone. Lower head is from the lateral pterygoid plate. Next we move on to the insertion. So origin is over. Next we move on to the insertion. So insertion is the upper head is in the pterygoid fovea. Pterygoid fovea. Next is the lower head. Lower head is in the TMJ, temporomandibular joint capsule. So lower head is in the TMJ capsule, as well as the articular disc. Next is we move on to the action. So what is present in the action? So action is it depresses the mandible. So this is lateral pterygoid. So depress the mandible. This is with the suprahyoid muscles. Next is the jaw protrusion, as well as grinding. Grinding refers to the side to side movements. The next muscle in line is the medial pterygoid. So this medial pterygoid, the origin is the superficial head is from the maxilla. Next is the deep head. The deep head is in the lateral pterygoid plate. There is deep head. Deep head is at the lateral pterygoid plate. And also the palatine bone. Next is how is it inserted? The insertion here is the angle of mandible. This is all about the medial pterygoid and the ramus of the mandible behind the mandibular foramen. Ramus of the mandible behind the mandibular foramen. Next is we look at the function. The function of the medial pterygoid is it elevates the mandible. Elevates the mandible, there is jaw protrusion, as well as there is grinding. Grinding is nothing but side to side movements. Then comes the temporalis and the masseter. So here in the temporalis there is a temporal fossa, the temporal fascia. This is the origin. There is temporal fossa as well as fascia. They are the origin. Next, when you look at the insertion, where is it inserted? Insertion is in the ramus of mandible. So it is in the ramus of mandible. Also the coronoid process. So we have the ramus of mandible and the coronoid process. Next, what is the function of the temporalis? The function of the temporalis is it elevates the mandible. There is side to side movement, as well as there is jaw retraction. Lastly, we look at the masseter. The masseter, the origin is the zygomatic arch, and this is present in the ramus of mandible. Ramus of mandible is where it is inserted. Next, what are the functions? The functions of the masseter includes it elevates the mandible as well as the jaw protrusion is seen. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.